In this video, we're going to talk about our appendicular skeleton, which is the bones of our limbs and the girdles that support our limbs. Our learning objectives are to identify the bones of the appendicular skeleton and relate structure to function, to describe how our shoulder girdle allows for arm movement, to define locations of some key muscle and ligament attachments, and to compare the male and female skeletons, paying particular attention to the male and female pelvis. We'll start with the bones of our shoulder girdle, which is the clavicle and the scapula. The clavicle, otherwise known as the collarbone, attaches to the manubrium medially and to the scapula laterally. And this is the brace that helps hold the arm away from the thorax. The scapula is our shoulder blade, and it has these triangular wings. It's a flat bone, and the major processes are the acromion and coracoid processes. The acromion helps connect with the clavicle at our acromioclavicular joint, or our AC joint, and the coracoid is the thing that points over the shoulder if you touch it on the posterior side. We also have a suprascapular notch, which is the passageway for nerves, and this is loosely held to our axial skeleton by our trunk muscles. It has a superior medial and lateral border, as well as a superior, inferior, and lateral angle. The most important part of the scapula is the glenoid cavity, which is the socket for the arm bone, and it helps form the lateral angle. The shoulder girdle allows our arm to freely move, in part because of the loose attachment of the scapula. It allows for a sliding back and forth. That glenoid cavity is shallow, and it's also poorly reinforced by ligaments, giving the arm lots of flexibility. But the arm is also easy to dislocate, in part because of how loosely and poorly reinforced the shoulder cavity is. Now let's talk about the bones of our upper arm. The humerus is the long bone. It has a rounded head that fits in that glenoid cavity, and then also has greater and lesser tubercles, which are the bumps at the top, at the proximal side of the humerus. In the middle, we have a deltoid tuberosity. Tuberosity means rough spot, and is frequently a place where muscles will attach. Here, it's where the deltoid attaches. And at the distal end, we have the trochlea and the capitulum, which articulate with the bones of the forearm. The surgical neck is the most frequently fractured part of our humerus. We also have a radial groove, which holds our radial nerve. And we have fossa, or indentations, the coronoid and olecranian fossa, which allow for the elbow to bend and extend. In our forearm, we have two bones, the radius and the ulna. The radius is the thumb side, and the ulna is the pinky side. You can remember this because radius is rad. We have distal and proximal radial ulnar joints, which are where those two bones meet, and they're connected by an interosseous membrane. We have styloid processes at the distal end, which help form our wrists, and the tuberosity on our radius is called the radial tuberosity, and this is where our bicep attaches. On the ulna, we have an olecranian process, which is the bumpy part of your elbow. It helps grip onto the trochlea of the humerus. Let's talk about our hands. Hands have three types of bones. We've got phalanges, metacarpals in our palms, and carpals in our wrist. The phalanges are named pretty straightforward, as are the metacarpals, but the carpals themselves, this is where things get a little tricky. We have 8 carpal bones bound by ligaments, 5 metacarpals in our palms. Their heads are forming our knuckles, and then 14 phalanges, 3 in each finger and 2 in the thumb. Now, we will in class come back to the carpals because you do have to know the names of your carpal bones. Let's talk about our pelvis. So our pelvic girdle has 2 coxal bones. Don't mix them up with the coccyx. The coxal bones are your hip bones. And then in the back, that's where the sacrum and coccyx bone are located. These are large, heavy bones. Your coxal bones are large. They're attached to your axial skeleton via sacral attachments, and they have deep sockets for our femur. Their function is to bear weight. They carry all of your upper body, and they also protect your reproductive organs. The coxal bones are a fusion of 3 bones, the ilium, the ischium, and the pubis. The alae are the wing-like parts. They're what you feel when you put your hands on your hips. And the iliac crest ends in an iliac spine. The bone that you brush against when you sit down, this is the ischium, and the tuberosity is the part that actually receives the sitting weight. The narrowest part for women for childbirth is formed from the ischial spine, or this bump right here. The acetabulum, this is that deep socket for our femur. Let's talk about the difference between male and female pelvises. A few terms to keep in mind. A false pelvis is the distance more superior between the wings, and the true pelvis is the part surrounded by bone, that inlet. This is where the child actually passes through. We also have a pubic arch, which is measured here. And looking at the male pelvis on top and the female pelvis on the bottom, you can see that the male pelvis has a narrow arch because the bones are more facing upward, whereas for females, we have a larger inlet because the bones are more laterally flared. This also gives us a rounder appearance and a greater pubic arch. All of this works together to create a larger opening for the child's head to pass through during childbirth. Let's talk about the bones of our lower limbs. So the femur is the long bone of our thigh. It's the heaviest and strongest bone in our body. On the proximal end, the head articulates with the acetabulum of our hip bone, of our coxal bone, and the neck, again, is that common fracture slit. The angle of the femur coming out of the hips, this is called the medial slant. And in women, because our hips are more flared, we have a larger medial slant. This can lead to some knee problems, especially in female athletes. At the bottom, we have our patellar surface. This helps form our knee joint. Patella, a sesamoid bone, will rest here on our patellar surface. On the back side, on the posterior side here, we can see the gluteal tuberosity, the rough spot where the gluteus maximus attaches. And then at the distal end, we have medial and lateral condyles to articulate with the tibia of the lower leg. The tibia is our shin bone. It is larger and more medial than our fibula. The proximal end articulates with our femur, and then the distal end is going to form our inner ankle there with the medial malleolus. The anterior border is the ridge that you can feel when you run your hand down your shin, and the reason you feel it is because it's unprotected by muscle. We also have a tibial tuberosity, which is where our patellar ligament attaches. Now, the tibia and the fibula form proximal and distal joints, similar to the bones of the forearm. The fibula is the more thin and stick-like bone. It's not a part of the knee joint at all, but it does have a lateral malleolus that forms the outer ankle. Looking at our foot, the foot supports our weight and helps propel us forward, and it's set up very similarly to our hands. We've got phalanges, a distal, middle, and proximal, metatarsals forming the sole of your foot, and the tarsals forming your ankles. The 7 tarsal bones, the largest are the talus and the calcaneus. These are the most weight-bearing of the bones in the foot. We have 5 metatarsals numbered similarly to the way bones in our hands are numbered. And for our phalanges, we've got, again, 3 per toe, except for our big toe, which only has 2. Now, while I will ask that you memorize the carpals in our hands, I'm not going to ask you to memorize the tarsals, except for the talus and the calcaneus. These other tarsals, you do not need to know. We have now completed our skeleton. In the next video, we'll talk about the joints, and we'll end with a quick conversation about developmental aspects.